Hi friends, welcome to Nursing Online Education. In this video we will be discussing important questions and answers of different nursing competitive examinations. Guys, let's get started.
Which nursing diagnosis takes priority for A? Newly diagnosed patient with a left-sided stroke? A. Risk of impaired swallowing related to absent gag reflex. B. Risk for impaired skin integrity related to immobility. C. Risk for infection related to invasive line placement. D. Risk for impaired speech related to left-sided stroke. And the answer: A. Risk of impaired swallowing related to absent gag reflex. Next question. When caring for a patient with left-sided homonymous hemianopsia resulting from a stroke, which intervention should the nurse include in the plan of care during the acute period of the stroke? A. Apply an eye patch to the left eye. B. Approach the patient from the left side. C. Place objects needed for activities of daily living on the patient's right side. D. Reassure the patient that the visual deficit will resolve as the stroke. And the answer: C. Place objects needed for activities of daily living on the patient's right side. Next question. A client with a serum glucose level of 618 mg per dl is admitted to the facility. He's awake and oriented, has hot dry skin, and has the following vital signs: temperature 38.1 degrees C, heart rate 116 beats/minute, blood pressure 108/70 mmHg. Based on these assessment findings, which nursing diagnosis takes the highest priority? A. Deficient fluid volume related to osmotic diuresis. VB. Decreased cardiac output related to elevated heart rate. C. Imbalanced nutrition, less than body requirements related to insulin deficiency. D. Ineffective thermoregulation related to dehydration. And the answer: A. Deficient fluid volume related to osmotic diuresis. Next question. A patient has a blood glucose level of 60 mg per dl. The patient is to receive 15 g of carbohydrate. If the blood glucose is less than 70 mg/dl, how many mls of orange juice should the patient receive? A. 120 milliliters. B. 90 milliliters. C. 60 milliliters. D. 30 milliliters. And the answer: A. 120 milliliters. Next question. A patient has a blood glucose level of 60 mg per dl. The patient is to receive 15 g of carbohydrate. If the blood glucose is less than 70 mg/dl, how many candies should the patient receive? A. 4 candies. B. 6 candies. C. 8 candies.
D. 10 candies.
And the answer: B. 6 candies. Next question. A patient is scheduled for a pneumonectomy in the morning. Which of the following diagnosis is the most likely indication for this type of surgery?
A. Lung carcinoma.
B. Pulmonary tuberculosis. C. Benign pulmonary nodule.
D. Mediastinal shift.
And the answer:
A lung carcinoma.
Next question. The nurse is caring for a patient with a deep vein thrombosis, DVT. The patient's heparin sodium. Infusion has been discontinued and the patient is receiving prescribed warfarin sodium, Coumadin. The nurse should advise the patient that which of the following needs to be continued? A. Daily complete blood count, CBC. B. Laboratory tests for partial thromboplastin time, PTT. C. Strict bed rest. D. Wearing elasticized support stockings. And the answer. D. Wearing elasticized support stockings. Next question. A patient receiving a total parenteral nutrition through a central line suddenly has difficulty breathing and is restless. Chest auscultation reveals a heart murmur.
Blood pressure 90/60 mm heart rate, 120 mm respiratory rate, 22 mm temperature, 37.1 C oxygen saturation, 90% on room air. What is the most appropriate initial nursing action? A. Notify the physician. B. Administer 100% oxygen by face mask. C. Place patient in left side lateral decubitus. D. Obtain stat blood glucose measurement.
And the answer.
C. Place patient in left side lateral decubitus.
Next question.
A 16-year-old boy fractured his right tibia and fibula during a football match. 8 weeks later, the fractures were successfully healed and the cast was removed. Which range of motion exercises would be most beneficial? A. Active C. Combined. B. Passive D. Resistive.
And the answer.
A. Active.
Next question.
A 65-year-old woman who was diagnosed with hypothyroidism at the age of 45 is brought to the clinic by ambulance. On arrival, she had a severely decreased level of consciousness. Her breathing is shallow and irregular. The skin is cool, dry, and pale. There is generalized non-pitting edema of all extremities and face. Blood pressure 70/40 mm/Hg. Heart rate 60 mm respiratory rate, 12 vol Indian body temperature, 35.5 C tympanic. What is the most appropriate method to re-warm this patient? A. Warmed intravenous isotonic fluids. B. Place the patient in a warm bath. C. Apply heat packs to the head and neck. D. Cover the patient with hospital blankets.
And the answer.
B. Place the patient in a warm bath.
Next question.
The physician ordered a blood glucose test for the neonates. The nurse knows the best site to puncture is usually A. The lateral heel. B. Anterior sole. C. Fingertip. D. Anterior scalp.
And the answer.
A. The lateral heel.
Next question.
The nurse is teaching a patient who was recently diagnosed with rheumatoid arthritis affecting the hands. Which of the following treatment should the nurse discuss with the patient at this time? A. Transcutaneous electric nerve stimulation, TENS. B. Iontophoresis. C. Nonsteroidal anti-inflammatory drugs, NSAIDs. D. synovectomy.
And the answer.
C. Nonsteroidal anti-inflammatory drugs, NSAIDs.
Next question.
A 34-year-old quadriplegia patient resides at home with his wife. In order to prevent contractures of all extremities, the community care nurse will instruct the patient's wife in performance of A. Active range of motion exercises. B. Passive range of motion exercises. C. Active and assistive range of motion exercises. D. Resistive range of motion exercises.
And the answer.
B. Passive range of motion exercises.
Next question.
A 6-year-old patient has presented to the clinic with fever, malaise, and anorexia. The patient was treated 2 weeks ago for a streptococcal infection of the throat. The nurse should expect the physician to order what test? A. Electrocardiogram. B. Jones test. C. Spinal tap. D. Heart biopsy.
And the answer.
A. Electrocardiogram.
Next question.
A 40-year-old woman presented with right hip pain. Palpation of the pelvic girdle is normal. An X-ray shows bone deformities with osteolytic lesions and bone enlargement. The patient has not suffered any trauma and has been generally healthy. Which serum laboratory analysis would be most useful? A. Prothrombin time. B. Alkaline phosphatase. C. Acid phosphatase. D. Parathyroid hormone.
And the answer.
B. Alkaline phosphatase.
Next question.
A client complains of itching about 20 minutes after he began his blood infusion. Which of the following is the best nursing action his caring nurse must take? A. Stop the infusion immediately and call the physician. Call the physician immediately and stop the infusion. Culminate the client and continue infusion. Continue the infusion while monitoring the client closely.
And the answer.
A. Stop the infusion immediately and call the physician.
Next question.
A 32-year-old woman with diabetes mellitus type 1 underwent a cholecystectomy and is now on day 2 of recovery. The patient's bowel sounds have returned and she has resumed a normal diet but has been finishing less than half of each meal on the tray. The nurse enters the room to perform a routine assessment and finds the patient confused and shaky. Blood pressure 110/60 mmHg, heart rate 96 semi-Armenian, respiratory rate 22 mmHg, temperature 37.0 C. Oral. What is the most appropriate initial intervention? A. Administer glucagon. B. Notify the physician. Give an insulin injection. Offer a glass of juice.
And the answer.
B. Notify the physician.
Next question.
A cancer patient wants to stop chemotherapy and change to palliative care. This situation indicates which psychological status? A. depression, B. hopelessness, C. anxiety, D. restlessness,
And the answer.
B. hopelessness.
Next question.
What do we call the type of treatment of terminal illness patients? A. conservative, B. curative, C. palliative, D. selective.
And the answer.
C. palliative.
Next question.
Psychiatric patient appear violent for himself and others, was put in the room alone during the period of exacerbation. Then patient calmed down and informed the nurse, "I am okay, now let me with others," but the nurse refused that as a punishment way, at which underline, label, will nurse accused under the court. A. divorce, abandonment, B. false imprisonment, C. negligence, D. duty to act.
And the answer.
B. false imprisonment.
Next question.
Which of the following actions is the first priority of care for a client exhibiting signs and symptoms of coronary artery disease? A. decrease anxiety, B. enhance myocardial oxygenation, C. administer sublingual nitroglycerin, D. educate the client about his symptoms.
And the answer.
B. enhance myocardial oxygenation,
Next question.
What is the first intervention for a client experiencing MI? A. administer morphine, B. administer oxygen, C. administer sublingual nitroglycerin, D. obtain an ECG.
And the answer.
A. administer morphine.
Next question.
A patient complains of stable angina presented with chest pain. The physician ordered nitroglycerine tablet sublingual. The nurse knows that the right dose to give the patient is A. 0.1 mmHg, 0.2 mmHg, 0.40 mmHg, 0.8 mmHg.
And the answer.
0.40 mmHg.
Next question.
Cancer patient during the shift, and he's surrounded by visitor and laughing loudly before the shift end. Patient called the nurse and asked for pain medication and said that his level of pain, 810, severe pain. Patient appears not on pain. What is the best intervention for this situation? A. Give the patient extra dose of his pain medication. B. Ask the patient about the last time he had his medication. C. Ignore the patient as you are going to leave. D. Check the patient's file for history of drug abuse.
And the answer.
D. Check the patient's file for history of drug abuse.
Next question.
A patient with pain was prescribed ibuprofen 300 mg FU 4 hours PRN and morphine 5 mg FU 4 hours PRN. After 2 hours of receiving ibuprofen, the patient still complaining of pain. What is the best intervention? A. Wait 2 hours and give a second dose of ibuprofen. Give the patient his dose of morphine. C. Wait 1 hour and give the patient his morphine? D. Ask the patient to bear the pain.
And the answer.
E. Give the patient his dose of morphine.
Thanks for watching. Subscribe for more videos.